Just wanted to count down for PCTV. 10 seconds. I'd like to call to order the study session of the Board of Health for June 17, 2026. Clerk, will you please call the roll?
Board Chair Hitchen,
Excused?
Vice Chair Bushnell,
Present?
Board Member Herrera,
Present.
Board Member Mello,
Here.
Board Member Olson,
Here.
Board Member Ryasich,
Excused?
Board Member Sadalge,
Here.
Board Member Yambe,
Excused?
Alternate Board Member Cook,
Here.
Alternate Board Member Ayala,
Here.
Alternate Board Member Diaz, Alternate Board Member Merrick.
Here.
Roll call complete.
Thank you very much. Roll call complete. I just want to give everybody a heads up that at 2:30 there was an updated board packet updated on the website. There's a correction to the link. The link that was originally posted was incorrect, and so there is at 2:30 there was an update to the board packet that included the correct link there. So next up we have our gun violence prevention and a public health approach. I would like to call up Andy Rohr and Elizabeth Allen. Come on down.
Good afternoon, Vice Chair Bushnell, members of the board. I'm Andy Rohr, Assistant Division Director for Strengthening Families Division. We are happy to be here to talk about our work to prevent gun violence and discuss how we might be able to expand work by partnering others in the community. Next slide. As you can see, we're going to walk through how this work connects with our strategic plan, talk a little bit about Gun Violence Awareness Month, what a public health approach looks like, working upstream with prevention efforts, and also looking at the why around population health. We will talk about, share some of our efforts in 2024, 2025 around community organizing, and talk about our current efforts, including a recent push to bring more lockboxes throughout Pierce County, and what's next to help prevent firearm violence in Pierce County. Talk about our strategic plan. We see that our efforts align directly with our plan. We've got specifically Measure C, Strategy 7, where we talk about including strengthening partnerships, improving access to prevention efforts, and increasing the sense of belonging, especially for youth. It's tied to a plan. Next. As I said, National Gun Violence Awareness Month. Pierce County Executive and Board Member Ryan Mello earlier proclaimed June of 2026 as Gun Violence Awareness Month in Pierce County. It is a time to recognize that all deaths are preventable. Properly secured firearm is far less likely to be used to commit a violent, tragic act. This being National Gun Violence Month, will reiterate a segment of national data recently put forth by Pierce County, which is that the firearms are now the leading cause of death among American youth of ages 11 to 18. It's an incredibly important issue. It's a national statistic. That's a national statistic. Next slide. We'll see, we turn our attention now to Pierce County data. So we can see here the graph of the data for firearm-related deaths for those ages 10 to 14 years old, or 24 years old here in Pierce County, dating back to 1990. these rates show deaths per 100,000 people. As you can see, the rates were much higher in the 1990s and have started to creep back up since the low point in early 2010s. Additionally, you can see the points right in that today that Pierce County firearms are the second largest cause of death for people ages 15 to 34, with drug poisonings and overdoses being the number one cause for this age group. The firearms are the second largest cause of injury death for those 35 to 64. Cancer and heart disease have become more common in this age group, with dropped firearm rates a little bit lower. But we could see that very important issue both nationally and locally. Next slide. Our past work, particularly through Peaceful Tomorrow, focused on bringing people together across system holders, community organizations, and community leaders. Priority of this work was also to ensure the majority of our resources went into investing in community-led solutions so that we didn't duplicate efforts and make sure we invest in those already doing great work. Ideally, so finally, we found that the focus on building a foundation for a public health approach to violence prevention. I'd like to invite Elizabeth Allen up to present the next few slides. Elizabeth is our program manager for a behavioral and emotional health program, the champion and advocate on this subject. So, Elizabeth.
Thank you, Andy. Vice Chair Bushnell, members of the board. I'm Elizabeth Allen. I am the program manager for the behavioral and emotional health team here at the health department. I'm going to walk you through the next couple of slides here in terms of what we have been doing and where we'd like to move forward with our new opportunities. So first, with our youth violence prevention contracts that we had mainly in 2025, we were able to subcontract with Imagine Justice Project. What was so great about that was they were able to help us prioritize the community members that were already addressing firearm violence, which concluded in us distributing over $120,000 through subcontracts with Imagine Justice Project that then helped fund 19 organizations throughout Pierce County. Through this effort, we were able to help serve more than 3,000 youth. Also, additionally, with this work, we were able to bring together over 100 plus community partners, strengthening ties, the collaboration across Pierce County. This effort was able to help advance that public health framing to address firearm violence. We are also, during this time, we held 5 different type of roundtable kind of conversations with about 41 youth to help inform us with the public health campaign that I'll talk about in a minute here. So next slide. So our emergent goals, ever-changing landscape here with the needs of Pierce County and how we can continue to stay current. So our emergent goals for this work is obviously reduce firearm lethality. We want to improve data collection and sharing. We want to advance the policies and systems change. We also want to explore violence prevention infrastructure. What does that look like for our county? What does that look like for our communities? But the goals are clear. We need to reduce that lethality. We need to have safe storage. We need to continue working with our youth through prevention-like campaigns and messaging and education, as well as with our communities. And we're also focused on conflict resolution trainings at this time. Next slide, please. So our safe storage efforts, properly storing firearms is the best way to help reduce the lethality of firearms. The health department started providing free gun lock boxes through a variety of funding back in 2019. Efforts would start and stop based on the resources available, as well as the focus of the needs of Pierce County. Obviously, we know this is a huge need. We have distributed a little more than 1,000 lock boxes during those effort time periods. However, we continue to expand our safe storage efforts. The funding started with the city of Tacoma. Thanks to the additional funding from Pierce County, we are able to continue this expansion. To date, before our current lockbox efforts here in June for Wear Orange Month, we had already distributed over 300 lockboxes since January through various funding. So we are well on our way to continue that distribution and increase that outreach. This would not be possible, and I just want to thank everybody here as well as online. This would not be possible without our external partners such as Kaiser and leveraging our internal connection with family resource centers. Our biometric boxes, by the way, are the most popular, so that is what we will be focusing on in terms of providing lock boxes to the community. Biometric boxes are very easy access, they're quick to use, and they also improve safety. So next slide here, our Pierce County expansion. I'm very excited to talk about this. So last week, Pierce County announced $300,000 investment to provide 1,500 biometric lock boxes. That also will include community outreach, education, connecting with our communities in a valuable way, and that education piece as well. We are just very, very grateful, Executive Mello, and we are very excited to expand those efforts. Thank you so much. These funds, again, will help distribute those lock boxes, provide the education, as well as looking at sustainability throughout our communities. What does that look like? What do our families need to stay safe? What do our communities need to stay safe long term? As I mentioned earlier, we have already distributed about 300 lock boxes prior to this newer initiative. That was the first 6 months. Since then, we have already distributed over 220 biometric lock boxes and 175 combination lock boxes just in these past few weeks. And again, we are expecting more lock boxes to come in, roughly about 1,500 that we can pass out throughout the county. We recognize that we have had a great deal of interest in our public, and we are definitely doing our best to fulfill that. We have a wait list going for those who are interested in lock boxes and couldn't get them right away. We are also replying to every email personally to let them know not only when the lock boxes will be available, where they can get them, as well as additional education, encouraging people to go online to our web pages, including our Choose Peace web page, which is my next slide here. So we have started a youth campaign, prevention campaign back in 2025. It is called Choose Peace. So moving from those safe storage efforts, we also want to focus on youth-informed public health in general. This campaign launch back in 2025 has already received over 5.5 million impressions. People are definitely going on this webpage, looking at this campaign. The primary impressions that are happening are obviously through social media, Instagram, TikTok, and Snapchat. So this campaign is on all of those types of platforms. We really want to reach communities where they're at, and we're really happy that we could do that through this campaign. So next slide here, talking a little bit more about the web page. So I told you about the social media campaign with Choose Peace, but we also have a web page. And up to date, we have ad impressions that translated over to 22,000 visits to this web page. So I told you about the 5.5 million on the social media platform, but then people are also clicking the link to go to the actual web page, and that is 22,000 here. So we are very, very pleased with that outreach, and we know that our efforts are going to continue with that meaningful engagement with prevention efforts. So one of my last slides here, I wanted to tell you a little bit about our conflict resolution trainings, and I think this is a great opportunity We're handing out safe storage efforts. We're talking about prevention, and this is another part of prevention and supporting our communities and our neighborhoods. And so our conflict resolution trainings are consisting of two cohorts. There's 6 trainings each, so a total of 12 trainings. These trainings focus on conflict transformation, de-escalation, trauma-informed approaches, and community building practices. These are adults generally who are youth-serving organizations that are attending these trainings, and they've been extremely successful. The goal is to use these skills to connect with youth, to build those skills across not only the providers, but also to reach as many youth as possible with this skill building type. Again, that trauma-informed approach, how to relate and have good relationship building among youth, again, to decrease conflict type of violence that happens. So the facilitator of these workshops has a dedicated experience leading these types of trainings. Again, excited to see the outcomes. What I have heard so far is that they have been excellent trainings. Our participants are very happy with the results so far, and very, very happy for the opportunity to have this type of training. Of course, it was no cost to them. They just had to sign up and be dedicated to attend those 6 trainings, which are once a month. All right, I'm going to hand it back over to Andy now.
Thank you. And so what's next? Right, you can see here our plan for the future is to continue with several different efforts, right? We continue to get lock boxes out to the community. We continue our public health campaign, continue conflict resolution training. We'll continue to do outreach in the community. We'll also be able to always be on the lookout for more ways we can partner and convene stakeholders around this very important issue. Last slide. So with that, thank you for listening, and we'd be happy to answer any questions you have.
Great. Thank you so much. I'll open it up to the board. Questions or comments?
I had, is it my turn? Okay. I had a couple of questions. On the youth violence prevention contracts, you said funded 19 organizations. Can you give me a little more color on the types of organizations and what they did and what they do?
Sure, absolutely. I would love to provide you that information offline if that's okay via email. We have some wonderful metrics and more detail that I don't have in my notes, and I apologize. That was last year in 2025. I do know that there were a lot of really good youth serving organizations who were connected with youth, especially at-risk youth, looking at those, their main goals being like protective factors and improving the lives of youth in general and really focusing on youth prevention.
Yeah, absolutely. Please email it over to me. I'd love to kind of understand what organizations and what they're doing. Another question I had was around improving data collection. If I recall correctly, aren't there federal prohibitions on collecting data? And if so, how does that affect our ability to collect data? It's something that's been frustrating for me from what I understand, but I'll let you guys.
Yeah, we definitely, there's always barriers to collecting data. I would say with what we would like to see in terms of data collection is connecting with those who do have data resources, but maybe we just don't have data sharing agreements yet or MOUs. And so that's what we look like. That's what we're looking at in terms of improving data systems, how we talk and how we collect our data, whether that is through hospital visits, through social services. And so it's really having this opportunity with this funding to be able to have those conversations, to be able to look at what is available that maybe we haven't thought of yet and be able to have that collaboration and partnership. So yes, there's always barriers to data collection. For this purpose, though, it's more of us strengthening those partnerships with with organizations that are collecting data that maybe we haven't really had a good conversation with yet.
Got it. Is there a plan or a timeline on reviewing the data and presenting some information and early kind of potential wins. Obviously, a lot of work we're doing right now is based on data that was collected a while ago. I'd love to understand how we can enrich that and come up with new tactics and more emergent kind of.
Yeah, that is an excellent question. Through our work plan, we are working those out right now in terms of those details, but we would really like to start those in the next, those conversations, those connections in the next 60 to 90 days, where we have a firm timeline on who, what, where, and when, if you will. But definitely that is a top priority for us in the next, even in the next couple of weeks, to really be able to connect with those community partners that we haven't connected with before, to start collecting that data immediately. And, data dashboards, and developing those, as well as continuous reporting out in terms of our findings and trends that we see.
And last question is around the conflict resolution training that's geared towards adults who interact with youth. I'm actually very intrigued by this. I think this might have been something that was mentioned. Is 2 cohorts it, or are there plans for additional cohorts? What's the near-term future of something like that?
That is a great question. Thanks to our new funding, our $300,000, we have that in our budget to continue that work. These cohorts end at the end of summer, beginning of fall. So we would like to then start some again, then possibly mid to late fall, and have them go into early spring of next year. But yes, that is in our plan to continue those conflict resolution trainings. Right now, the funding is coming from the city of Tacoma, so we've focused our conflict resolution trainings on those youth serving organizations in Tacoma. And now with our new funding, we can expand that throughout Pierce County.
Absolutely. That is definitely something I'm very keen on continuing to support if we can on the city council. It's so important that we reach out and directly touch the children and the young adults that are caught up in all this, because obviously gun violence is absolutely a big issue that we need to be cognizant about and do something about. So thank you very much.
Thank you.
Thank you, Board Member Sadalge. Next up, we have Councilmember Ayala online.
Thank you, Chair. I've got 4 questions. I want to start off with kind of a follow-up on Board Member Sadalge's question around data collection. I'm curious around what conversations might be existing, or maybe this is part of the plan, for those organizations that don't necessarily have a sophisticated data collection capacity. So whether it be because of staffing or just the technical ability to do so, is there anything along the lines around shared data systems, or maybe connecting folks with one another to see how they could do some asset building work?
That is a great question, and that is exactly why we would like to, have these conversations, which we are already starting. But then, who do we tap into? Who does have this information? Where are the gaps? Where are the people that are organizations that would like to be collecting more data, but maybe don't have the systems or the structure? And that's where we really come in to be able to support that. But really, it takes time for us to look at that, have those conversations. Also, possibly do a needs assessment, look at the gaps. But we have such a great support staff here that is able to really help us move through that, so that we can collect valuable data, as well as looking at those trends.
Good afternoon, Chantel Harmon-Reed, Director of Tacoma-Pierce County Health Department, for the record. Board Member Ayala, I want to make sure I get it right for the record. Just to piggyback off of what Elizabeth was saying, we are working with the Resiliency Hub with the county, and some of the work that Dr. Owens is doing, Dr. Shawnice Owens, our Director of AEE, with the work that she's doing with Dr. Modaris in coordinating systems through the Resiliency Hub is routinizing and standardizing some of the data collection across the county. There is a significant amount of work in understanding data systems and standardization not only in our dashboards and collections, but also in other areas and partners across the county. So more work to be done and more information coming.
Wonderful. Thank you so much. My next question is around conflict resolution. I'm curious if you're able to share who will be offering those classes or the facilitator curriculum origins.
Absolutely. So we have a contracted person right now who has been doing the conflict resolution trainings prior. She has extensive resume with these types of trainings. I'm happy to send an overview or summary of the curriculum to the board so that you can review it. But mainly it is very, very focused on that skill building aspect of looking at alternative ways to have conversations, relationships, and engage with folks, especially when you are not agreeing with something. And also looking at, too, that mental health aspect of not increasing, anger or disappointment when engaging with other relationships.
Good afternoon, Melanie Lopez, Division Director for Strengthening Families. I actually have an answer to Mr. Sadalge's question about the 19 organizations. Just to give you a sampling, I could read them all, or I could just give you a sample. Justice for Girls Coalition, Institute for Black Justice, Big Homies Ministries, Brotherhood Rise Center, The Game Time Way, Empower Youth Futures, Innovative Changemakers, Crownless Kings, Pearl Foundation of Puget Sound, Priceless Inspiration Foundation, Royalty Foundation, The Creatives Collective, Amara, Buckley Youth Center, the Red Barn Youth Center, Entertainment Resources Alliance, Platinum Rain Studios, SOP Projects, and the Night Media Foundation. So they all received additional funding and support to work on these. So those are the 19 organizations that we partnered with. So looking forward to other partnerships as well. So that's hopefully a quick answer. We can also send the details in an email as well.
Thank you. I've got two more questions, if I may, Chair.
Go ahead.
I'm curious about the website footprint, the traffic footprint that this work is taking. Does the health department have an overlap of where that geography is coming from?
That's a good question. I do not believe so, but Kenny here can answer that.
Hello, Kenny Villa, Director of Communications here at the Health Department. Yeah, excellent question. We do have data on where we get some of the visits specifically from social media. As far as the website goes, it's more, I think, the total number of page views. We can't see directly where they're from, but we can pull together what data we have and share that with you for sure.
Thank you. Appreciate that. I have a lot of curiosity of where the population's coming from and also where those gaps in our area might be where we can dedicate a little attention. And then my last question / comment, I want to thank you all very much for acknowledging the work that Imagine Justice Project did in helping support and facilitate this kind of work. I know they're no longer in operations, and I'm curious if the role that Imagine Justice played previously is a role that currently exists, or it's manifested through a different scope of work, or if there's been individual relationships that the department has made with the various organizations that are being partnered with.
Yeah, absolutely. And we definitely miss Imagine Justice Project. It is a both and. Our work has definitely expanded. We are still supportive of the work that Imagine Justice Project had, and that has morphed, if you will, into other connections with other great partnerships, as well as different collaborations. But we still focus on that work and those meaningful partnerships that we have in the communities, as well as opening our doors to new opportunities too.
Wonderful. Thank you so much. Thank you, Chair.
Thank you. Next up, we have Board Member Yambe.
Thanks, Board Chair. First, I wanted to just piggyback on the thanks to all the gun violence prevention and violence prevention organizations that do this work and the Imagine Justice Project. It was a really helpful program, and do a shout out to Lorraine Stone because I know she had did a lot of work on collecting some data, and the many other people who were part of the process, and also a shout out to the executive for tapping me to be there at the announcement of our securing the $300,000 for the county council's investment in lock boxes, safety lock boxes, and but I wanted to ask, and also thank you to my colleagues because this was the first year that the county recognized Gun Violence Awareness Month. So I wanted to plug that too. I wanted to check Elizabeth, do you know how much the biometric lock boxes themselves cost? Because I got some inquiries and about that, and didn't have an answer because I know that $300,000 to some it was like you're buying all these lock boxes and there's only 1,500. But then I was trying to point out that it has to do with outreach and education around it. But could you be able to tell them a little bit more about the costs per?
Andy and I are going back and forth. Andy was we were just having discussions because we have a variety of, vendors that we're looking at right now. And of course they have different prices. So I thought that you might want to mention the specific.
Yeah, could you repeat the question one more time?
So the price point average-ish per, biometric lockbox.
Yeah, so as we have mentioned, we are looking at, we're placing different orders right now. So as you mentioned, the lock boxes also includes a education piece, obviously shipping, but essentially the ones that we're looking at, they have a range of anywhere between $67 to about $90. Some, like the ones that were distributed at the press conference on the 8th, some have biometric plus locks plus combination. So they have options essentially like on them. So we're ordering a variety because we've noticed that a lot of people like to have that variety in terms of what they'd like to choose. But so some of them might be a little bit more expensive because they offer 3 options to be able to secure and lock it. Others might just have the biometric. So the prices range anywhere from, again, approximately, and this is a base price of, anywhere from, $67 to about $90 pre-tax, pre-shipping, pre-education. So hopefully that helps. There are varieties.
Okay. I think that helps because there were some inquiries like when we did the announcement, people heard 1,500 and then all of a sudden they're trying to do math and they're like, that's like, a pretty high price per lockbox. And then it was like, well, there's 2 other components that, are a part of it. And, big is about education and making sure that, it's not just the one-time thing themselves. And while those are extremely important in, deterrence and, every second counts when it comes time to, break-ins into a vehicle, but also it's the behavior, it's the education components, which sometimes does require a significant investment, and sometimes that lasts longer than just the distribution of the box themselves. So I appreciate that clarification.
Thank you.
Board Member Herrera.
Thank you, Chair. Just had a quick question on what are the parameters for someone to get? I might have missed it. One of the lock boxes.
Yep, we have a waitlist sign-up sheet right now, and we have information about that on our website, as well as you can visit our family resource centers. We do have a list of participating family resource centers. As I spoke up earlier, we are currently waiting for our next shipment to come in, but we do want to encourage people to go visit those family resource centers that are identified of having the lock boxes in the future, because they also have other information as well in terms of safe storage and keeping your family safe in general with firearms.
Thank you. I have another question. It's just kind of a monkey wrench. Like a lot of other sometimes government giveaways, what prevents folks, getting a lockbox and then the next thing you see, lockboxes for sale and OfferUp and eBay?
I wanted to just briefly answer the question before that and just say, because it was in the slide before, but I want to make sure folks know, you can actually go to tpchd.org/lockboxinfo. If that's a link that you can go to sign up for that list, where then we will provide information on when and where we'll have lockboxes available in the future. Thanks for going back. So it's right there on the slide as well.
Okay.
To answer your question, public health viewpoint, one life lost is too many. And that is our purpose for providing firearm storage. We want to make sure that people have the resources they need to store their firearms safely and effectively. There will always be the what ifs when it comes to providing resources to the community. But what we are doing is essential to ensuring that our communities are safe and feel safe, because that is part of resiliency and that is part of building better communities for the future.
Okay. All right. Thank you. Thank you, Chair.
Thank you, Board Member. Board Member Mello.
Thank you, Vice Chair Bushnell. Thank you so much to the Health Department for working on this initiative for a number of years now and continuing to evolve and grow the initiative. I think the multifaceted initiative is so important. I think it's essential that the Health Department continue to hold center on this for Pierce County. I think we're the right agency to hold center for gun violence prevention. We all have a role to play, and someone has to hold center in my mind. And I think the Health Department is the right place to do that. And taking a holistic public health approach is so important. When we started to do youth violence prevention town halls last year, we heard from young people about the need for safe things to do out of school time. We heard about this very need from young people from Gates High School in particular, about other young people they know how they have access to firearms that are not properly secured, and also law enforcement. And we also learned that a stolen gun is 9 times more likely to be used in a crime. And we learned about how so many vehicles are being broken into largely for the purpose of trying to find a stolen gun or to find a gun and then steal that gun. And that is the driving reason, according to local law enforcement, that is the driving reason for car break-ins, is to look for a stolen vehicle, because they're finding so many folks are leaving their gun in their car because they're going to a place that doesn't allow them to have a gun, or they don't want to take their gun into wherever they're going. And so folks know that their gun is underneath the seat of the car or in a glove box. And that is the cause of so many car prowls and car break-ins. So again, all to the public health approach about increasing education, trying to meet people where they're at, giving them the tools that they need to keep their firearm out of the wrong hands. And all the and this is not a one-trick pony, right? This is a multifaceted approach to gun violence prevention, which I'm very grateful for. Just 2 points or two questions from me. What is the division's plan to continue to coordinate with the State Office of Firearms Safety and Violence Prevention with financial resources and other resources the State Office of Firearms Safety and Violence Prevention might have in order to further expand the partnerships, the scope of work, and additional resources here in Pierce County on this very important topic.
Thank you, Board Member Nalo. It's actually a really good question. We have a follow-up meeting actually tomorrow with county leadership, with state leadership as well, because there are funding sources that are going to be putting out RFPs for additional opportunities for not only lockboxes, but several different avenues to address gun violence just in general across our communities. So we're looking at not just lockboxes, but the conflict resolution. We're looking at all preventative measures that we can do to support how do we do injury prevention across the board. We're going to be using opportunities like those to do a concerted effort between city, health department, county leadership to develop planning so that we are bringing those funds here so that we can bring staffing, so that we can bring resources to build a composite plan so that this is an ongoing. We've seen a response specifically to this initiative. It has been overwhelming across the board. So we want to make sure that when we not complete, but when we reach the maturation of this particular plan, that this is not just a cliff. We continue this for the long term, and that we can not only just look at what happens right here in this immediacy, but look at like how does this reflect reductions in gun violence? How does this reduce firearm violence? How does this look just overall? Like how do we compare this to reductions in injury prevention in the county overall? So there's going to be several initiatives, and we're going to be inviting not only just those partners that I mentioned, but community partners to sit at the table with us to join into these conversations.
Thank you for that. And my last thing, I'll end with a request. As we work to launch this additional investment in gun safety and properly securing firearms, we've heard from statewide leaders who work on this issue that they are really pleased about the way that Tacoma-Pierce County Health Department is exhibiting leadership and launching this effort, and they're really using our effort and our program to encourage other localities to do something similar. And so that is another great example of how local leadership can blossom into something to have even more impact, more regionally, more counties, more cities, more health departments, and eventually statewide or beyond. And so I think we should never underestimate the power of what starting out like this can and should do. I think it's incredibly powerful. And to that end, I will make a request that, again, I firmly believe the health department should hold center on this. And I think that includes continuing to be a strong, data-driven public health voice at the state level. There will be really focused statewide policy around safe storage. There's already some policy on safe storage, but there's a lot of gaps in the statewide policy on safe storage. And I really think that the health department should lead in this area and be a strong voice in statewide policymaking for safe storage, for more responsible gun owners to keep them out of harm's way.
Thank you. It centers around the leading causes of death. And I just want to acknowledge this, just as Elizabeth and both Andy have mentioned, it started with the seed planted from the city. So we appreciate those funds. And then receiving the additional funds from the county just allowed us to grow that. So as I mentioned, and I mentioned in our leadership team meeting this morning, we're just going to continue this. This has to be an embedded part of who we are as the health department. So we really appreciate the investment that you've made in this programming here. So really appreciate it.
Great. Thank you. Any other board questions or comments? All right. I have some myself. I just thank you so much for the presentation, and just thank you so much for everybody and everybody that does all the good work out there in the community. It's just so impactful what happens out there. And I also want to acknowledge that even today, this morning, we had a young person allegedly discharge a firearm right outside of Gray Middle School in my district. And so thankfully nobody was hurt. But that is just really, really hitting the point home that the prevalence of firearms in our communities is way too high. And so I appreciate the leadership of the county, my colleagues at the city for continuing to press on this, the work of the health department and all the other organizations that are doing the good work. Certainly a lot more needs to be done. And as been mentioned, a vast majority of the weapons that are used in a crime are stolen, and most of them are stolen out of vehicles. And so safe, secure storage of firearms is a personal responsibility for every firearm owner. And I'd love to see some state policy around requirements of demonstrating that you do have safe storage before any purchases of firearms. Personally, that's what I would like to see. And that's something I would advocate for at the state level. Some of the questions that I have specifically, I saw some really concerning data come out of Workforce Central around disconnected youth. And for those that aren't aware, disconnected youth are those young people that are not enrolled in school. They're participating in things that are probably not to their betterment. And is the health department able to utilize that data to help support some of our programs and directly targeting those that might be disconnected in that way?
Thank you so much for that question. When we look at the higher level overview of youth prevention, we certainly think about protective factors and social connections. What we do know around this work in terms of firearm violence, in terms of violence in general, is when youth are connected to a trusted adult, to a trusted community, they are less likely to engage in risky behaviors, and that includes violent behaviors. And so absolutely, that is a population that we want to address more. We have been engaging with, and we hope to engage more with, as you said, disconnected youth. We all know that protective factors are essential, and we want every youth to feel connected to their communities because we know that drives down, again, those risky behaviors, including violence.
Right. Thank you. If you guys have not seen that data, certainly would recommend
thank you.
Getting that from them. One of the other questions I had, and to my comments earlier, is just the prevalence of firearms out in our community. Historically, there's been work around like gun buybacks and things of that nature. How would somebody that maybe found a weapon, is there an opportunity for them to turn that in a safe manner? Do we have depositories or ways that people can bring firearms?
We would really encourage them to connect with law enforcement at this time. Mm-hmm. We are definitely, through our community partnerships and collaboration, discussing on how we can expand that. What does that look like for our communities as we launch into this more programming around safe storage? That is absolutely a topic that we will be discussing and seeing how we can expand that. But today, we would really encourage anybody to contact law enforcement if they do find any sort of weapon or firearm. Yeah, for sure.
Yeah, I think there's certainly some additional opportunity for education. If folks find firearms, there's basic firearm safety that even young people could understand. Hey, you find it, let an adult know, all these other things, and then working with our law enforcement to make sure that what we're communicating is right for them as well.
Absolutely. That is definitely part of the education, as well as just even those tough conversations around talking around, friends and family. Do you own a firearm? Is it secure before my child comes over and plays? Those are difficult conversations that we're hoping to encourage folks to speak out more often about, to keep everybody safe.
Right. Thank you. And then the final question, circling back to the lock boxes, which I think are really, really needed in our community. And it's just one piece of the overall pie of need. But because we are limited in resources, and 1,500 is a great amount of lock boxes, but as you mentioned, there's a wait list. Is there any way that we can utilize some data to make sure that we're targeting communities where firearms are most prevalently stolen? Is that under consideration? So that way we're making sure we're getting these, that they're most effective as we distribute them out in the community.
Absolutely. We have looked at our priority populations. We're continuing to look at that data because we know that data can change as the program grows, but we're absolutely, that is a priority to ensure that it gets into those high populations, those at-risk populations, those populations that are already seeing a great deal of need, definitely.
So when we put the proposal together, we actually did gather our data to specifically look at zip codes that were very high in theft, both from residential and vehicle areas. And so that was the priority within our scope of work. That said, we are looking to how we can partner with local law enforcement within, Tacoma and Pierce County as well with data sharing agreements because there's some data that we have access to and others that we perhaps do not, but we want to be really closely collaborating with sheriff, police chief, the different areas within Tacoma and Pierce County to really, again, work hand in hand with our law enforcement so that we have all of the right data at the right time. And we may need to do some shifts based on that data. So.
Great. Thank you so much. Yeah, I think, given the limited amount that we have, we want to make sure it has maximum impact, and any opportunity we have to get more is obviously a good thing as well. All right. That really ends my questions. I'll just say that this touches everybody's lives here in our community, and I personally have gone to too many memorials, and what happened over near Gray Middle School today is just another. It's ruined that young person's life. Just even having the firearm. And if they're committing a crime on top of it, it's over. And so we really need to find ways to prevent this. And I really appreciate the health approach. I think that there's more that can be done on the policy level. We'll be working together in concert with our friends at the county, the state, to see what we can do at the local level and wider. But it's really important that we're collecting data information to maximize our impact as much as possible, because as has been mentioned, one death is far too many. And I just want a personal point of privilege. I'm personally a firearm owner, so I'm not talking out of the side of my mouth here, but there's some level of personal responsibility that you have when it comes to owning a firearm that unfortunately far too many people really disregard. And so I think that on a personal level, that there's some level of accountability for those that are not being accountable for their firearms as well. And again, that's on the policy level, not necessarily here for the health department, but that is personally really offensive to me, that we have irresponsible firearm owners out there that are allowing their weapons to be mishandled or stolen. So I'll just end there. Thank you so much for all of your work. Really appreciate it. And I know that there are lives being saved with a lot of the work that people have been doing out there. So thank you.
Great. Thank you.
All right. Any final questions or comments from the board? All right. Next up, we have our continuity of operations. I'll call up Chelsea Bell. You could just tap the mic there. Thank you.
Okay, I'll start over. Good afternoon, Vice Chair Bushnell, members of the board. I'm Chelsea Bell. I'm an emergency preparedness coordinator working with what we call the FEPR program. It stands for Public Health Emergency Preparedness and Response. We are underneath the Division of Disease Prevention and Management. Next slide. We're going to tie the link to our strategic plan. We're going to talk about the update that occurred in 2025 and give you some highlights. We also updated a section for Board of Health, and we'll share the slide that talks about the roles and responsibilities. And then we're going to have an opportunity to have a discussion-based exercise once we talk about some of the roles of the Board of Health. And we're really going to focus on going through the thinking process. Just know that I developed the scenario. I'm not an expert in everything. So Some know that there's going to be some artificialities in the scenario. And so just kind of walk through what you can, and I'll answer any questions as possible. One thing that I really appreciate about our strategic plan is that there's an initiative for us, Measure D, which is to increase federal emergency management agency training completion rates for identified public health response leaders from 44% to 80% by 2029. We're going to do this by increasing emergency preparedness, response, and resilience. We do this by training and preparing staff for emergency response, and we strengthen and test emergency plans. So this exercise that we're going to do at the end of this presentation is going to be that test to our emergency plan. Next slide. So this is a little piece of engagement. So I just want to hear from the different board members. What are continuity of operations? What does it mean to you?
All right. Anyone want to take a stab at what is continuity of operations? What are continuity of operations? Here, I'll take a stab at it.
All right.
Continuity of operations to me means making sure that there's resilience in whatever it is that is occurring. So if there's a breakdown in certain areas, there's an opportunity for work still to continue. And if something catastrophic were to occur, there's still mechanisms and ways for operations to continue even through that adversity. And so building redundancy inside a system. And so it could be both internal to the different departments, depending on what they're working on, but also externally to our public on the service delivery that is expected of a health department, for example. And so that they're and then, everybody in the chain needs to know where their responsibility lies. And if there's a break in that chain, you may know what needs to be done above or below in that chain. So that's my stab at it. And so I'll open it up if anybody else has any additional, but yeah.
Well, my only input would be I kind of think of it as continuation of operations. So just how are things going to continue that need to be done in an emergency situation?
Great. So the FEMA definition, and you all hit many elements of continuity of operations, is really the capability of an organization to ensure that its essential functions continue during and after a disruption to normal operations. So you had many of the keywords in there, and you were able to explain many of the steps that need to occur. Great job. Next slide. All right, to highlight some of the main updates to our plan, it's not over-encompassing of everything, but just to really highlight some of the big takeaways. We added an activation process, aligned it with ICS, Activation Incident Command System, and using that structure. We also developed a notification and reporting structure, which included an HR ring line. So now we have additional redundancy to access our HR when we need to include accountability. So when we evacuate from the building, our safety monitors, as part of our safety monitor program, will take attendance of people in their zones, and each zone will then report back to our leadership about who's missing, who hasn't been accounted for. And that information is to go to our HR group to take final accountability of the status of everyone, to be able to give that information to Chantel. We're going to have actually a practice of this later this year during the Great Shakeout. It's a national level campaign. It's an earthquake exercise on October 15th. We're going to test our reporting and accountability processes this year. And then we also have, in addition to our COOP plan, the capability to assess infrastructure and the impact to that. So our facility staff have been trained through the Applied Technology Council. It's a training that is for post-earthquake evaluation. It's an actual training that has been developed with the Applied Technology Council and FEMA. So it's a FEMA approved course. And we do have staff that are trained. So we're not just relying on other agencies to come in and be able to evaluate whether we can re-enter a building. Our facility staff can do that. Next slide, please. All right, our Board of Health responsibilities. So the first two should look familiar. They are RCWs. The third bullet is also familiar because we tested this a lot during COVID-19, and it's also in our emergency operations plan, talking about emergency acquisition. And then our last bullet is really COOP specific. So knowing the line of succession for both the public health director and health officer positions. Next slide, please. So I'm going to talk about the operational process, what it looks like to protect people, account for staff, assessing the situation, and ensuring a continuity of operations. So first, an emergency occurs. It can be a small or a really big disruption. We then decide whether or not we need to evacuate the building. If it's a water main break, we're not going to evacuate the entire building. We're going to evacuate that affected area. And so if we need to evacuate, it's really important for us to then complete accountability. We need to assess the building damage. And then there's that discussion of reentry. What does that look like? So we send out our facility staff into the building. They take an evaluation, and then they come back out, and a decision is made with leadership about whether or not it is safe or not to reenter. And if it's not, we're going to have to activate our continuity of operations plan and also stand up an incident command system structure. We do have critical positions in the department where we've identified incident command system positions that need to be 3 staff deep. And so we do have people identified to act as an incident commander, but also a continuity of operations manager as well, our task force leader. And so we have been able to develop more of an ICS structure for the what if we do get activated and we need to go to that point. Next slide, please. All right. Again, this is just to lightly go through the process, and it is fictional. So just remember that. It's just for us to go through, and we're going to answer some questions in the next slide. But to talk about the snowstorm scenario, National Weather Service forecasts a major winter storm that will hit in 5 days. Single-digit temperatures are expected. 8 to 12 inches of snow forecasted in Pierce County over a 2-day period. This was really to take the 2018 Winter Storm Maya scenario where we had multiple days where we had lots of snow coming down. And because of the low temperatures, ice concerns are low. And coinciding with this incident is our HVAC system's not working. We had a complete failure of the hardware. We need to replace parts for an emergency fix, provided as an estimated cost. Again, it's fictional. And there's an opportunity for us to decrease the cost if we wait 2 months. Again, this is just optional. If we get an opportunity like this, it doesn't always happen. Just know that. Next slide, please. All right, and this is going to be the interactive part with the board. So I'm going to ask the first question. What are the safety concerns?
Open it up to the board. Safety concerns in this scenario.
Thank you, Vice Chair. I think there's safety concerns about staff getting to work, so traveling to work if they need to be in person and can't work remotely. There's potentially safety for being in a building that doesn't have proper HVAC, and then safety for if health department staff is trying to get to the emergency operations center to participate in the entire county response to such an incident, how they get safely to the emergency operations center to respond with the rest of the county operation in such an emergency.
All right. Anybody additional? Well, I think at least because it's cold, there's, the staff safety, even if the HVAC system's not working in the building, it's also cold inside the building as well. So I think that there is concern for any side of, personal injury because of that. And, pipes could burst. That could be a safety impact as well inside a building that's not properly addressed. So, all right.
Great. And one other element I would just consider is what about the public that are supposed to come in for our mandatory services that we must provide? something else to consider. Next question is, what alternative solutions can we implement to address the HVAC concerns?
Anybody want to take a stab at that? Board Member Sadalge?
If we can't fix it right away, I mean, remote work for those that can work remotely so that we don't have everyone here is one option. I don't know if there's also like portable equipment that could work or not work. I know that's always iffy because a lot of them will be gas powered, and then you also have the concern of carbon monoxide poisoning if it's too close, but potentially alternative heating sources.
Exactly. Great point.
Well, if an alternate solution, it's a solution, is to temporarily cease operations or not allow the public to come, let them know that there's a closure so that way there's time to get the fix done as well. So that's an alternate solution in order to at least mitigate the impacts of HVAC issue.
Anyone online?
This is Board Member Rice, space heaters.
Yeah.
I don't know if the electrical system would handle it, but if it does, you could keep the place warm enough to be in, at least for a while.
I'll jump in. I was going to mention space heaters, but I think if services are permissible, containing services to a very restricted area so it's not used throughout the building.
Yeah. All right. Now the question is, would you approve the emergency fix now knowing that there are alternative solutions of the HVAC system?
That's a tough decision. I mean, we'd have to assess the cost benefit, the amount of time it would take, because we could authorize the fix right away, but it could take 2 weeks for the parts to come in, and so maybe the emergency situations, it says it's for a 2-day period, may have already passed. And so if there's a lot of what ifs when it comes to whether an approval would be appropriate or not. At least that's the policy wonk perspective for me.
Okay, so then what are the next steps?
The next steps would, at least from my perspective, would be to assess how the situation occurred in the first place and see if there's anything that can be done to mitigate it in the future. If there's process improvement, maintenance improvement, or knowing that this scenario could occur in the future. If we have a forecast in the future of something like this, maybe there's a checklist. Like, let's double check these things to make sure they're good to go before this storm event comes through. So at least that's what I think of. I'll open it up to anybody else. Maybe I answered for everybody.
Chair, I'll jump in with something else.
Yeah, go for it.
I do agree. An assessment of the system would be definitely something that's needed. I think there's also an assessment of the effectiveness of the COOP, the staff activation and the efficiencies that take place. So how much is able to get done during that time, and also along this same lines, and this is related to the replacement of the HVAC system, what health department partners can be activated in this space, considering that there is an infrastructure failure. And so if we do have partners that that would temporarily decentralize services, that would allow the health department to consider any, as mentioned, like delayed part deliveries or anything along those lines. really looking into what the cost benefit of that.
Excellent point. All right, so now we're going to participate in a hot wash. This is a really common practice after an exercise. So I'm just going to ask two basic questions. What did you learn, and what would you like to learn more about in the future?
Well, I learned we have this, which is good to know. But I guess what I would what the questions or the ideas that were going around my head is around process operations and effectiveness of communication throughout this decision kind of matrix and understanding, do we have that? How do we have that? How can we share that information with other organizations that could benefit from just being aware that having a plan of not just actions but really of the way you want to make a decision in an emergency and the way in which you want to communicate those decisions effectively amongst people, I think is probably a really key portion of all this, as much as the plan itself. So I want to thank you for kind of adding that to my awareness.
Anybody online?
I'll jump with I'll admit I do not know what the line of succession is, and that is definitely something that needs to be on my radar.
Great.
For me, one, I appreciate this presentation. I think it really highlights a lot of things to think about, especially for such an important agency as the health department. One thing I'd be curious about in question is, what type of scenarios, likely scenarios, and then, based on risk factor, also what catastrophic scenarios that each department level may need to exercise some level of COOP, and what type of training and implementation they have in that, and is there practicing for an emergencies type situation. So I'm curious as if because each department is unique in its own way for what services they provide and how they operate within the department, and making sure everybody knows what the proper chain of command is in case of an emergency, what happens if this, and we could game plan what if scenarios and things of that nature, so that way everyone's kind of on the same page. So I'm curious about the departmental level COOP plans, so to speak.
Yeah. Any other things that you'd like to learn more about? Any other folks online? Okay. Next slide. So just to finish, are there any other questions that you may have that you didn't already ask in the last slide? Anything about COOP? No?
So one of the questions I had is, how does your COOP operations coincide with partner agencies and where they intersect? We talked a lot internally, but generally when things are catastrophic in nature, it takes partnership with EOC and others. South 911 probably, which is next door, great. Yeah. And then, how interoperability, I guess, in that way.
I will answer this one. Oh, Frank's going to answer this. He's my supervisor.
Come on down, Frank.
Frank Forsman, I'm the program manager for FEPR. I think what we do is once we develop a plan, we have to socialize it. And we do that through partners, and we send it out for feedback from those partner agencies. So we work, say, with DEM or South Sound 911 to vet our processes that we have written down. Then we share those so that everyone's on the same page and we're kind of level set across the board. And we do the same with their plan. So as part of our COOP plan, we've already set a foundation of what can the county do, what can the city do, what can surrounding counties do, and other agencies. And that allows us to build off that foundation of what we want to do internally, but knowing that if we need to reach out a little bit, we're not hitting them out of left field. We're just maybe falling into one of their plans that's also activated. Like if we're dealing with something internally here, they may be dealing with the same thing there. So we just kind of make sure we're on the same page to start with. And then when we exercise that, we're able to kind of stress those plans, try to break them and find out where those gaps are and then try to fill those gaps.
Great, thank you. Any additional questions or comments from the board? All right, seeing none, thank you so much. I think this was a fun educational experience. Appreciate it. All right, with that, there is no executive session today, and we are at the end of our agenda, so we stand adjourned. Thank you all so much. Have a great day.